Thank you, Mr. Rosendale. I recognize Mr. Sablan for 5 minutes. Mr. Sablan?
Yeah, thank you. Thank you, Chairman Takano. It's been a long night for me. I just got off our Ed and Labor hearing. Mr. Secretary, congratulations on your confirmation and on your becoming Secretary of the Department. I'm going to ask this question, and if you don't have an answer, maybe get back to us. But Congresswoman Radiwagan and I wrote to you asking about the department's plans to vaccinate veterans and VA staff in our district. That would be Northern Marianas and American Samoa. The VA is one of 5 federal entities receiving COVID-19 vaccine allocations to vaccinate their population, but we do not know if the department has provided vaccinations in our areas. We understand our local public health centers have used some of their allocation to vaccinate veterans and VA staff with VA's assurance that their supply will be adjusted accordingly. We're unaware that the replenishment has been as occurred. We ask that you ensure the department moves quickly to vaccinate veterans and VHA staff in our districts, and that the vaccine supplies utilized by public health centers for this purpose are promptly restored.
I think it's a reasonable request, and I'll take that. You have my commitment on that, and I'll take that to find out if the replenishment has happened. I'm under the impression that it has, but I'll find out to be certain on that question.
Right. Thank you. Thank you for that commitment. The comprehensive assistance to family caregivers is not available in my district, the Northern Mariana Islands, because there is no VA staff to conduct home visits and provide support services. However, many aspects of the application process and ongoing monitoring can be done online by phone or video applications. So only the initial home care assessments and possibly the annual reassessment require VA staff to visit the veteran's home. However, to reduce the risk of exposure and transmission of COVID-19, the department is now allowing all home visits to be done by video conference or other telehealth modalities for the duration of the national emergency. If home visits are not required, the lack of VA staff should not be a barrier to staff to access, Mr. Secretary. Would you consider extending this flexibility beyond the pandemic to allow veterans in areas like my district to access the comprehensive assistance to family caregiver programs? This is a place where you only have 2 staff, Mr. Secretary. We don't have a CBOC, you have a fee-based clinic. And veterans are really being denied of these services they are eligible for.
Thank you for raising it. I do think we need to make sure that we take a comprehensive look at all lessons learned from the use of telehealth during the pandemic to make sure that we establish that as the new floor and then grow off of that as it relates to looking specifically at whether the continued flexibility to use telehealth platforms for home visits in and around the caregiver program. It seems to me to be a reasonable question consistent with that. And so I'm happy to make the commitment to you that we will look into that, and we'll make sure that we come back to you with our answers on it.
Right. Thank you. And the your Hawaii regional office would be very helpful to you. In February, Mr. Secretary, my staff was briefed on the department's plan for implementing the VA healthcare expansion report language in the VA's fiscal year 21 appropriations. The language directs VA to increase access to direct VA care for veterans living in remote and underserved areas such as the Marianas, and strongly urges an increase of the number of full-time dedicated VA medical and mental health providers in those areas. In response, Dr. Adam Robinson, the director of VA Pacific Islands Healthcare Center, proposed to hire a primary care doctor or advanced practitioner who would travel to the islands of Tinian and Rota to see veterans and to build up and strengthen telehealth services in the area, to hire a psychologist or a licensed clinical social worker to provide psychology coverage. I was encouraged to hear of Dr. Robinson's response and his commitment to making this happen in 2021. I ask you for your support of Dr. Robinson's efforts and this this is an effort that sometimes starts and then with the change of personnel just goes away again, and it starts and goes away, and we don't have, we have again a nurse and an administrative personnel in my district secretary. We need your attention as much as possible.
I
Thank
will
you
make
very
sure that I
much.
follow up with Dr. Robinson on this. And I think you're right to feel that if you're speaking to Dr. Robinson, that you're speaking to the department. So let me follow up with him. And I think what you're asking is a reasonable question.
Mr. Secretary, my time is up, but thank you very much. And I really look forward to working with you as much as we can to improve VA services in the Northern Marianas.
Thank you.
Thank you,
Thank
sir.
you.
Are you back, Mr. Chairman?
Thank you, Mr. Sablan. Half a day. I know you've been up all night.
Yes, sir.
Mr. Trone.